We are determined to make you feel at home until country roads can take you home. Over the next several minutes, our students will lead you on a virtual journey through dental school. See the sophisticated technology that prepares future dentists for practice. Learn about the class and clinic grind that shapes extraordinary providers. Recognize the passion that prompts permanent connections with patients, faculty, and classmates. And until you can visit, welcome to the West Virginia University School of Dentistry, where mountaineers go first.
Technology is definitely a selling point at West Virginia University Dental School. It really blows people's minds. Even my family that's in dentistry, they don't even have high-tech equipment like we do, just because it's new and very expensive. I think it's a very high selling point and also makes WVU very competitive.
The Innovation Center that the school offers is one of the greatest experiences I think I've had so far in dental school. The Innovation Center is essentially, it's all donated to WVU School of Dentistry through dental companies, and essentially it's the high-end tech equipment, high-end dental materials that we get to use before we go into private practice.
I recently just completed a root canal, and to start, we took a CBCT. We now have 2 here in the dental school and 1 at the Innovation Center. This is a huge advantage, but what it does is it shows us the tooth in 3D. So what I found was I was able to see more canals, more roots than a regular PA that only gives you a 2D image.
I think we will definitely be a step ahead with everything that the school offers, and the small class size and the hands-on experience we have here compared to other schools is unlike any other. So I would say your freshman and sophomore year of dental school, it's more lecture-based, a lot of exams, you know, the library grind and study type of pace. I'd probably say you're in school probably from 8 to 4, and then after you get home, you know, you're going to be studying for the exams you have coming up. That's honestly the first 2 years. The last 2 years, you're mainly here in the main clinic, and then there's also a laboratory over here where we do a lot of our lab works. I mean, you know, starting out, it'll feel a little weird because it's something new you've never seen. You know, you're trying to get all your positioning right and working in a patient's mouth because, you know, you're simulating that. But I think after a few times you've done it, you really start to feel comfortable, and you form kind of a bond with your mannequin that you have there. And then you get into the main clinic, and what you applied in the sim lab, you apply it on a real person. So you're probably hearing a lot of noises. It's almost time for clinic again. So people are setting up, you know, getting ready for their patient. But, you know, the school and the university as a whole is doing a great job, you know, with PPE, social distancing. We're always wearing masks. Anytime we're doing a procedure, we're always wearing face shields. We always have an assistant. So it's a safe environment. It's a go, go, go process, honestly. You know, whenever you're doing a procedure, you're always with the professor to make sure what you're doing is going smoothly, there's no complications. And, you know, sometimes you'll have those days where you get stuck and you need a little bit of help, but the professor's always there to guide you along the way and help you out in any way he can. And it's busy in here. You know, there's 50 of us. Majority of us have assistants, some of us don't. There's a lot of bodies, everything's a go, 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 people coming in and out, but it's busy, but it's rewarding. Rural rotation is an awesome experience that I don't think many other schools offer, and I think we're one of the few that do offer that. It's a great experience. You know, you can, one, get what private practice feels like. So you essentially go away to a rural site for 6 to 8 weeks. You work with a private dentist, you see patients, you do everything that you've learned in dental school, but you apply that in a private practice scene. And it's a great experience because not only are you building confidence and skills that you know you've learned in school, but also you're helping out the rural communities that need it the most, and you're helping the disadvantaged, and it's a great experience.
What we do as a school is we're out there doing outreach, we're teaching people, we're going to Susan Duhoff and we're telling them it doesn't have to be like this, and we're actually changing lives. You know, oral health is whole body health, it's overall health. There's no separation. It's like saying your heart is separate from your body. We see a lot of people that conditions going on in their body are affecting their oral cavity. We've diagnosed cancers, we've diagnosed autoimmune conditions because they first presented to us. Yeah, you know, you become so close with these patients. A lot of them are already having anxiety that I'm leaving in May. So it's just really nice. Like, these people trust you. They call you on your cell phone on the weekends when they need you. And, you know, it just means a lot. It makes school so fulfilling.
I think WVU does a great preparation step those first 2 years. So when you get into clinic, you feel a lot more confident and you've been trained and educated well enough to where you're like, I know this is what I wanted to do. I think I'm ready.
You know, I think that we're lucky that our class sizes are not huge and the faculty get to know you on a first name basis within the first year. And the family connection here is just so strong. Like, you will have your power friend group that will just get you through all the hard exams and everything, but all of the administration, they want to be your friend, they want to help.
So it's a small class, everyone gets to know you, and I think that's actually a good thing because you get that personal one-on-one experience with the professor that, you know, maybe that some other schools don't offer because they have a larger class size, but that strong family connection will be played out not only in school but also outside of school when you graduate, and you'll always have a connection with them. Yeah, West Virginia, wild and wonderful, huh? So there's a lot to do here. If you're an outdoorsy person, this is definitely the state for you. You know, we have here around Morgantown, we have Cheat Lake where you can rent boats, you can go kayaking, you can jet ski. There's also this place called Cooper's Rock where it's a beautiful view over the mountains and into the valley. The Cheat River runs right through it. You can go hike there. There's also a snowboard ski resort about 40 miles away. It's called Wisp. It's in Maryland. If you like to snowboard and ski, you have that. A lot of golfing around the area. So yeah, there's quite a bit to do.
Morgantown is so fun. It's a college town. There's so much to do, and the Mountaineer pride runs thick around here.
We would be proud to have you. Visit our website, dentistry.wvu.edu. Then click on Students to learn how you can become a Mountaineer at West Virginia University School of Dentistry. And be sure to follow us on social media. We're on Facebook and Twitter at WVU Dental School.